Hi, I'm the clinician.
I'm the daughter.
I'm Maurice, the patient.
And I'm his wife. And we just want to give you a quick little background. So Maurice came in yesterday with his family, his daughter and his wife, and he was evaluated using the WAB, the Western Aphasia Battery, as well as the Boston naming test. So now is the counseling session after. Hello, everybody.
Hi.
Welcome back. So Maurice, I know the tests that I gave you yesterday were time consuming, but you worked really hard and you did a great job. I reviewed the results and the entire assessment, both the formal portion and the test portions, and it confirmed the previous diagnosis of Broca's aphasia, apraxia of speech, and unilateral upper motor neuron dysarthria. So before I get into the results and we talk about your possible treatments, does anybody have any questions for me?
So I know they explained this all in the hospital, but there was just so much going on. Can you explain to me what aphasia is?
Absolutely, that's what I'm here for. Ask any questions that you guys have, okay? Aphasia is an acquired language disorder. Oftentimes it's caused by a stroke. And there are a few types of aphasia, which are based on where the brain is affected.
So my mom, her friend, had a stroke and she got something that they call aphasia, but they called it Wernicke's something. It wasn't this one. Can you explain what that is?
Yes, so I believe you mean Wernicke's aphasia. And the biggest difference between the two is where the damage occurs in the brain. In Wernicke's aphasia, the damage affects the person's ability to comprehend speech. So it's also referred to as non-fluent aphasia. The damage in Broca's area affects a person's ability to produce speech, but their comprehension is unaffected, like in your father's case.
Oh, okay. I didn't know there were so many different types of aphasia.
Yes.
So what about his other diagnosis? It was something with an A?
Yes, apraxia of speech. So apraxia is an inability to sequence aspects of speech. So this happens when you want to say something, but it doesn't come out the way you want because the planning inside your mind, Maurice, has been affected. It's almost like a disconnection between the brain and the mouth.
Now, what about the other one? It was something like something? What is
Yes, dysarthria.
Oh.
So that is more of a muscle weakness. So Maurice, it's the weakness that occurs and the incoordination of your muscles, which happen when you're trying to speak and a certain sound is not coming out because you're not producing it properly because of the muscles.
How long?
I think what he's trying to say is how long the treatment's going to be.
Okay, so every patient progresses at a different pace. So of course it's going to depend on certain things. Now Maurice, it's going to depend on your motivation. It's also going to depend on family involvement and practice at home. How about I further explain some of the treatment options you have, and then we'll set a plan and continue to discuss how long it may take.
I'm good at that.
Great.
What option?
So what options do you have? Yes. Okay, so there are many techniques or therapy approaches, but I have narrowed down our long list to about 3, which I believe would be the most beneficial. So the first option is called melodic intonation therapy. So since the right side of your brain is unaffected and that area is in charge of music, it can make up for the affected left side. So it'll help your speech through the use of tempo, pitch, and stress of language. Almost the sing-songy part of speech being used to make up for the errors and smooth out your speech, allowing it to flow in a more natural way. The second method would be visual action therapy, which is based on the use of gestures for the primary mode of communication, which you seem to already be doing very well. It is a nonverbal approach which uses symbolic gestures to communicate fully as your means of communication. The third approach is called response elaboration training. So this approach is a more gradual expansion of your sentence production. So what we'll do is we'll start with a word that you already use, and together we'll work to expand that word to expand the sentence. So of course, all of these will be based on your interests. So, what do you think, Maurice?
Oh boy, love song.
Yes, I think that would be a great one, honey.
Great, so we'll begin with melodic intonation therapy.
So, will my dad ever speak like normally again?
Okay, so this isn't, as you know, a scrape on the knee. Since your dad experienced a stroke and as a result injured his brain, it's going to take some time to recover. There are clear positive prognostic indicators such as your family support and motivation. You guys have great communication, I see already, and you're definitely supportive, and Maurice is definitely motivated. So as treatment progresses, I'll keep data on his progress, and hopefully we'll see the positive changes as they come.
Okay.
So what can I do to help Maurice at home?
So practice is going to be your best friend throughout this process. What you do at home is going to make all the difference. Once we begin, I will give you some information to bring home with you. And if at any time you find him having difficulties, or Maurice, you find difficulties, you guys will be able to work together to use the melodic technique that we use in therapy. So of course, this would mean that it would be beneficial for you to accompany your husband or your father to the first few sessions to better understand the technique and what's going on in the therapy.
Yes, of course.
When start?
So when are we going to start? So we can start as early as next week. Do you have a time that works best for you?
Yeah, I believe 11 a.m. would be great. That's when he works best. He functions well in the morning.
Great. Okay. So I will see you 11 a.m. this Thursday. Does anybody have any other questions before we leave?
No, I think you answered everything. Thank you.
Okay. If at any time you do find that you have any questions, just jot them down and we'll discuss them on Thursday when I see you again. So I hope you all have a wonderful day. It was great to see you again.
Thank you. Thank you so
Thanks.
much.
Bye.